Time for our health checkup with Adventist Health Castle that we call In Sickness and in Health.
Today, our focus is a joint and spine center, which is not simply a place for services, but a team of people who are dedicated to the patient experience. We are going to learn more about the Joint and Spine Center at Adventist Health Castle, talking now with Jane Raymond, a joint and spine navigator. So start by telling me exactly what the Joint and Spine Center does.
So the Joint and Spine Center at Adventist Health Castle focuses on hip and knee replacements as well as spine surgery. We do neck surgeries, cervical fusions, lumbar surgeries, lumbar fusions, microdiscectomy, laminectomy. We can do artificial disc replacements. And then for our hip and knees, we have a robotic. We're the only ones on Oahu to have the Navio robotic system, which is excellent for our partial knee replacement patients.
How about your role as a joint and spine navigator? What exactly do you do?
Absolutely. So I've been with Adventist Health Castle for 5 years, and I've been with the Joint and Spine Center as the nurse navigator for about 3 years. And I follow the patient from beginning to end, which can begin as soon as they attend one of our seminars. And then when they're scheduled for surgery, I will do a preoperative education class with them, be there for them as a resource to answer any questions, let them know about what they can expect in their recovery. I see them while they're in the hospital, and then when they get home from the hospital, I do a discharge follow-up phone call to check in on them and make sure they don't have any questions about their care. I also collaborate with the team to make sure that the patient has a smooth process from beginning to end. I look at patient outcomes and patient safety. As a clinical nurse leader, that's part of my background.
What types of procedures does Adventist Health Castle do?
Well, Adventist Health Castle was just rated the top hospital in Hawaii State by the Lown Institute, as well as number 25 in the nation. We're a Blue Centers for Distinction for hip and knee surgery as well as spine surgery. And we just received a 5-star rating from Healthgrades 2021 for hip fracture and spinal surgery.
Well, thank you so much for telling us about the Joint and Spine Center and for all of your services. What are next steps? What is happening at Adventist Health Castle?
Sure, we have free virtual seminars that are open to the community. We have one coming up on November 19th with our hip and knee physician champion, Dr. Linda Rasmussen. She'll talk about hip and knee pain and non-surgical and surgical treatment options, and you can call to register.
We have the opportunity to learn more from a patient. Carolyn Wren is joining us to talk about her experiences.
My experience was wonderful. Castle was such an easy experience. Everyone from the time I checked in until the time I left was absolutely caring. They wanted me to feel like I was the only one there, and that's how I felt. I had every member of the team check in on me. I felt very taken care of, very safe in this time of COVID.
And how are you feeling now? Tell me about how your progress is going.
Oh, it was so easy. I had to come into the hospital to get a COVID test the day before the surgery, and that was very easy, very comfortable, not a problem at all. And I knew that afternoon of the results. I checked in the next morning for my surgery, and everyone took such great care of me. Once again, I felt very safe, and the doctor had explained, Dr. Rasmussen had explained everything to me, taking care of me. She told me what was going to happen, and the surgery went so well. The next day, I was checked out at the time that they said that I would be, and I'm very, very pleased.
You know, it was great to have a chance to talk with a patient about that, especially in these
times now doing the COVID tests and so forth, and to get the reassurances about having such a great experience, because it can be intimidating, as you know, when you have to go in to have these type of replacement surgeries done.
Yeah, you know what? I've had far too many that I even care to mention, but it's nice to be able to be comforted while you're there. And